Are you stuck in the rest, run, repeat cycle, meaning you get injured, take time off, feel better, and then bam, the same foot or ankle pain comes right back? Here's the truth: rest alone won't fix it. And if you've been told to just take a break and hope for the best, then this video could be a game changer for you and that what you need as a runner. So let's talk about the number one mistake runners make when recovering from a foot and ankle injury and what to do instead. Hey there, runners. I'm Dr. Abby. I'm a physical therapist and fellow runner, and today we're diving into the number one mistake I see runners make when recovering from foot and ankle injuries. And yeah, it's probably not what you think. If you've ever been told to just rest after an injury, then this one, it's for you. All right, why resting just doesn't work. Let's talk about it. You roll your ankle and on a trail or tweak your foot after a long run, it swells, it sores, and you're sore and you're told to just rest. No running for a few weeks. So you wait, maybe ice it, wear a brace, and then you start to feel better. So you lace up and hit the road again. And then your injury is back. It starts to hurt again. It doesn't feel great. This sounds familiar? Rest might reduce pain and swelling, but it doesn't rebuild strength, improve joint mobility, or prep your body for impact. It doesn't signal to your body that your joint, your area is ready to take on the impact of running again, so it protects itself. Rest alone is passive, and recovery needs to be active. I'll say that again because it's the key. Recovery needs to be active. You need to actively do something. Motion is lotion. Let me tell you about one of my clients, Sarah. She's 42, a half marathoner, and super consistent with her running. She started having ankle pain, just kind of came on out of nowhere. She says out of nowhere. So there are signs, but started coming on out of nowhere, and her primary care told her to rest for 4 to 6 weeks, no running. So she did it. She even skipped her fall races that she had been planning and training for. But then, come January, when she started to run again, the same ankle pain came back, this time with some arch issues too. So what happened? First of all, she lost strength. She lost proprioception, her body's sense of position, and she didn't retrain her foot to handle the load of running again. And this happens all the time. That old principle of rest, ice, compression, elevation for injuries is just outdated and doesn't work. So the result is a frustrating, never-ending loop of, I think I'm better. Oh, nope, not yet. Let's rest again. And then you stop running altogether and think that running just isn't for you. So, what does real recovery look like? Recovery isn't just about getting rid of pain, it's about rebuilding what was lost. First of all, mobility. Can your foot and ankle move through the range of motion without pain or restriction? Second, strength. Are your foot muscles, calves, and even your hips strong enough to support your stride and support your running? Third, progressive loading. Can your tissues handle the stress of running again without breaking down or re-injury? This is what I guide all of my injured runners through. We start with gentle mobility work, progress to body weight strength, and then load gradually until you're back to running strong. For example, James, he's 38, had posterior tibial tendonitis that flared up every time he tried to return to running. But instead, when he started working with me, we focused on slow, progressive loading, things like single leg calf raises, banded toe work, and gait drills. And within 10 weeks, he was back to running 5Ks with no pain. He didn't rest his way out of it because that didn't work in the past. He trained his way out of it. He worked through it and made his body adapt and capable of not hurting. So the solution. So if you're dealing with a foot or ankle injury or you're tired of the start-stop cycle, please don't just rest and hope for the best. Even if it rhymes, it is not the thing to do. You need a structured recovery plan that walks you step by step through what your body actually needs to heal and return to running safely. You need progressive mobility, progressive strength, gradual return to running, and targeted exercises both in stability and mobility to get your body ready for it. And I've got exactly what you need. You need my 12-week foot and ankle programs designed specifically by me for runners for less than a cost of one physical therapy appointment. you can do this structured, done for you, guided through exercise program that encompasses everything you need for rehabbing and bulletproofing those feet and ankle. So whether you're trying to get back to running after therapy or you need a program specifically for your feet and ankle, check the links below. I'll see you next week with more foot and ankle issues.